This time of year can be stressful, and people may notice more jaw and pain and lots of headaches too.
Michaela Davidson is joining us to go over the treatments and remedies that can help. Thanks so much for being here.
Yeah, thanks for having me back.
I feel right now I should probably like loosen our jaws and not be so tight.
Do you feel tense already just knowing we're going to talk about it?
I'm like hyper aware. Like, am I clenching my jaw?
Yes.
Like, am I relaxing my face?
Yes, the number of patients this week alone that have been like, oh, I have the worst headache or my jaw feels so tight. Like, the holidays are upon us because everybody's feeling it.
That's a weird... Like, it's weird to have that cause so much. Like, you wouldn't think like tightening your jaw would affect your head.
Right. So what happens, a lot of people carry tension and stress by clenching their teeth together or grinding their teeth together. Sometimes people will do it when they're awake, sometimes it's when they're sleeping, but we describe it a lot as, imagine if you did bicep curls all night long. You would wake up in the morning and your arm would be so fatigued it wouldn't function the way that it's supposed to. And in the same way, when you tighten those masseter muscles together really tight all night long over the span of 8, 10, 12 hours, it gets really fatigued and then it doesn't want to open and close the way that it's supposed to. It gets really tight and can cause a lot of headaches and then jaw pain in return.
Is that like that clicking sometimes, like when you're like, and it like pops?
It can be. Honestly, the jaw noise is very common and nothing that we usually get too worried about unless you're having pain with it.
Okay.
It's kind of like cracking your knuckles because it's a jaw, it's a joint, right? So you can have some noise, but when you start having pain, then there's maybe some underlying things going on.
So what does TMJ stand for?
Temporomandibular joint. So some people come in and they say, I have TMJ. Well, we all have TMJ. Right? We all, that's the joint that functions. So some people have disorders associated with it. In teeth, we can see sometimes wear in different areas depending on if you're clenching or grinding. And so if we notice that when you're coming in for regular visits, we might mention it to you like, hey, do you ever wake up with headaches? The biggest thing is kind of figuring out, number one, are you doing it when you're awake or you're sleeping? If you're doing it while you're awake, that's best case scenario. So then you can be aware of it. A lot of people, if they're really concentrating on something or working, they'll clench those teeth together. So even if you do it now, you can feel right in here, right, like along your cheekbone kind of, those muscles really fire up.
Oh,
and
yeah.
so that's kind of that's a big hitter for that jaw pain. If you're someone that suffers from jaw pain, kind of some easy things to do at home. Like we kind of said, number one, try to figure out if you're doing it when you're awake or you're sleeping. If it's awake, then just be more cognizant of it. Yes, right? Sometimes certain foods that we eat can make it worse. So if you're having jaw pain and you're eating steak, bagels, chewing gum, those are all things that are gonna make it worse.
I can't chew gum for that.
You wanna baby your joint while it's really flared up. Ibuprofen typically will work better than Tylenol with that anti-inflammatory. It settles it down. And then even before you go to bed at night, putting like a warm washcloth or a heating pad, try to get those muscles to relax. It seems like if you can get them to relax before you go to bed, maybe you won't quite engage those muscles or fire them up quite as much.
Well, I was going to ask, because like if you do it at nighttime, like how can you stop?
Right.
Besides,
you can't.
Okay. So there's not like something you can, like a retainer or something you can put in your mouth.
So there's a mouth guard that we can make for you, and that's probably one of the most conservative things that we can do to try to help. So essentially the purpose of that is to hold your jaw in a more neutral position so you can't fire those muscles up. It also is going to help protect the teeth. So if you are engaging and tightening things up, you're going to wear through that guard rather than wear down your teeth. So if you've done all these things at home and you're like, yep, this is now affecting my day-to-day life, because I think in general most people experience some sort of jaw pain through some point in their life, right? Whether you're in school or you have a lot going on at work or in your family, you feel that with stress on occasion, but if it's affecting your day-to-day life, then you want to do something about it. We also can do therapeutic Botox, which is where we inject Botox into the masseter muscle, your temporalis muscle, And you think of Botox and you think, well, I'm not going to be able to function, I'm not going to be able to move, but you totally can. It just relaxes those muscles. And then the goal of that is to try to retrain your brain, because when the Botox is working, you can't fire it up quite the same. And so you kind of retrain your brain over that time period. Botox will metabolize and kind of be out of your system within 3 months, and then you can see if you want to do it again.
And hopefully you're cured.
Yes, right.
That is, excuse me, that is so interesting.
I know.
I would have never realized that, like, a simple thing like stress could affect this,
Yes,
literally
everything.
the entire system.
Yes.
So that has been very interesting. Thank you so much, Michaela.
Yes, for sure.
Polish Dental is located in Bismarck and accepting new patients.
They utilize state-of-the-art technology with gentle care and create personalized treatment plans for their patients' individual needs. To schedule an appointment, call 701-222-4746 or 222-GRID. I was like, how many twos did I say there?